The College of Nurses of Ontario presents the RN and RPN Practice, the Client, the Nurse, and the Environment webcast. One of the college's roles is to develop practice standards and guidelines. These documents outline the expectations for nurses that contribute to public protection. They inform nurses of their accountability and the public of what to expect of nurses. The purpose of this webcast is to help you to apply the RN and RPN Practice, the Client, the Nurse, and the Environment Practice Guideline. The presentation focuses on the three-factor framework, which is a concept explained in the practice guideline. This framework helps you determine which nursing category is best for specific roles in client care based on three factors: the client, the nurse, and the environment. Please note that the role of nurse practitioners is not defined by client complexity. Therefore, they are not included in the practice guideline or this webcast. The learning objectives of this webcast include identifying and applying the three-factor framework to your own practice and having a better understanding of how to make decisions about the use of RNs and RPNs in practice. When making decisions about which category of nurse to match with specific client needs, you must consider the client, the nurse, and the environment. We will discuss each of these factors in greater detail to help you apply the framework to your practice. The first factor is the client. This factor includes three components: complexity, predictability, and the risk of negative outcomes. We will discuss each of these components separately. Complexity is defined as the sum of the variables influencing a client's current health status, the variability of a client's condition or care requirements, and the degree to which a client's condition and care requirements are identifiable and established. Let's look at each part of the definition. The first part is the sum of the variables influencing a client's current health status. Some questions to ask are: what is affecting the client's health? Are there many health concerns? Are there many existing health conditions or medications? What is the client's level of independence? Does the client have family supports? The second part is the variability of a client's condition or care requirements. Some questions to ask are: have the client's condition and care requirements recently changed? How much and how quickly is the client's status expected to change? The third part is the degree to which a client's condition and care requirements are identifiable and established. Some questions to ask are: how much do I know about this client? Do I know this client's condition and what care he or she will require? How likely is it that I can gain more information about the client? When combined, all three parts of the definition form a picture of the complexity of the client. The second component of the client factor is predictability. This is defined as the extent to which a client's outcomes and future care requirements can be anticipated. Some clients may be expected to follow a predictable pathway, while other clients will not. Consider how likely it is that the client's outcomes and care requirements can be anticipated. For example, has the client experienced this health condition in the past? Do clients with this condition typically have similar outcomes? The third and final component of the client factor is the risk of negative outcomes. This is defined as the likelihood that a client will experience a negative outcome as a result of the client's health condition or as a response to treatment. Think about the negative consequences of the client's condition and the possible negative outcomes as a result of the treatment. Just as certain health conditions carry higher risks of negative outcomes, some nursing interventions also have a higher risk of negative outcomes. This continuum shows the range of client complexity. On the left, the client is less complex, more predictable, and at a low risk of negative outcomes. This client, from the perspective of the client factor alone, would be appropriate for RN or RPN practice. As you move along the continuum to the right, the client becomes more complex, less predictable, and is at higher risk for negative outcomes. For this client, from the perspective of the client factor alone, there is an increased need for RN consultation and collaboration. On the far right side, the client would require an RN to provide all nursing care. Think about a time when you cared for a client who presented with less complex healthcare needs, but over time the client's status changed to one of increasing complexity with a high risk of negative outcomes. Did you collaborate to meet the client's needs? Whom did you collaborate with? Was there a point when the care needed to be transferred to another care provider? What did you learn from this experience? If you were to encounter this situation again, would you do anything differently? The second factor in the framework is the nurse. When we talk about this factor, it is important to remember that we are addressing the individual nurse's competence, not the competence of all nurses within a category. Nursing is one profession with two categories, RN and RPN. Both have the same scope of practice statement and access to the same control acts when ordered. All nurses are accountable for adhering to legislation and college practice documents. The foundational knowledge for both categories is the same. However, RNs study for a longer period of time, which affects the depth and range of their foundational knowledge. All nurses enter the profession with a foundational knowledge appropriate to their category, demonstrated by meeting the entry to practice competencies. Throughout their career, nurses continually enhance their knowledge and competence, which increases their ability to engage in autonomous practice and provide care to clients with increasingly complex care needs. As nurses reflect on their competence, they identify areas in which they may need to consult and collaborate. All nurses, regardless of their category, are accountable for their own actions and decisions. Some nurses are able to assume more autonomous care, while others need more consultation. The ability to care autonomously for clients and the need for consultation are directly related to the competence of the individual nurse. As the competence of nurses varies from one nurse to another, so will the ability of each nurse to provide client care autonomously. Consultation involves seeking advice or information from a more experienced or knowledgeable nurse or other healthcare professional. The amount of consultation needed is determined by the complexity of client care needs and the nurse's competence. If the client's complexity changes and an increased level of nursing competence is required, the nurse may consult within the team. The availability and accessibility of consultation resources are influenced by the practice setting. When a nurse consults with another care provider, it results in one of the following outcomes. The nurse gets advice and continues to care for the client. The nurse transfers a part of the care to the consultant, or the nurse transfers all care to the consultant. The nurse who is seeking consultation remains accountable for the care unless the care is transferred to another member of the team. Reflect on how your knowledge base has grown since you entered the profession. How much have you learned about your area of practice through your experiences? Think about the individual expertise each of your nursing colleagues adds to your practice setting. Consider the opportunities for growth that have been presented to you through practice reflection. How can you use these opportunities to improve your practice? The last factor in the framework is the environment. This factor has three components: practice supports, consultation resources, and the stability and predictability of the environment. We will discuss each of these components separately. The first component is practice supports. When looking at the supports available in your practice setting, consider whether there are clear and identified procedures, policies, assessment tools, and care guidelines. These resources help nurses in their decision-making and decrease the need for consultation. As a result, it is possible for a nurse to care for a more complex, less predictable client. Also, consider the number of expert nurses and nurses who are familiar with the environment. These nurses can support others through consultation and collaboration. The second component is consultation resources. Having a high proportion of expert nurses as practice supports is one thing, but are they accessible and available to consult with others to manage outcomes? Are there other consultation resources available to manage outcomes? For example, other members of the healthcare team may also be familiar with a setting. The third component is the stability and predictability of the environment. Think about the rate of client turnover and the frequency of unpredictable events in your practice setting. Lower client turnover and fewer unpredictable events enable nurses to care for more complex clients. When combined, all three components of the environment factor form a picture of the overall stability of the environment. This continuum shows the range of environment factors. When practice supports, consultation resources, and the stability and predictability of the environment are all considered, there should be a general idea of whether the environment is more stable, less stable, or somewhere in between. On the left side of the continuum, the environment is more stable. From the environment perspective only, this would be appropriate for RN or RPN practice. As you move along the continuum to a less stable environment, there is an increasing need for RN consultation and collaboration. On the far right side is an environment that would only be appropriate for RN practice. Reflect on a situation where you were able to draw on environmental supports to help your decision making. Did you have easy access to consultation resources? Were there tools such as policies or other resources that helped guide your assessment? If you believed environmental supports were lacking, did you follow up by advocating for improvements? Let's review how these factors of the framework are applied in practice. In the emergency department, clients present with varying complexity, predictability, and risk of negative outcomes. The clients in an emergency department may be assessed anywhere on the client continuum from less complex and more predictable to highly complex and less predictable. Therefore, the role of the triage nurse is not appropriate for RPN practice. However, following the triage assessment, nurses should work together and apply the three-factor framework to make decisions about the use of RNs and RPNs. Now let's look at the nurse factors. John, a highly experienced RPN with a broad clinical knowledge base and assessment skills, has been autonomously caring for a client, Mr. Jones, and has not required RN consultation throughout his shift. On the next shift, Maya, the RPN that is to replace him, has significantly less experience. Although the client and environment factors are unchanged, in this situation we have a change in the nurse factor. Maya has less experience and expertise in this area of practice, so she is questioning her competence to care autonomously for Mr. Jones. It is possible that Maya will be able to care for him in consultation with an RN resource. However, it's also possible that Maya would require so much RN consultation that the need for consultation would exceed the efficient delivery of care. In which case, Mr. Jones's care should be transferred to an RN or an RPN with competence in this area of practice. Maya must assess her competence and make a decision regarding her ability to care for Mr. Jones. If Maya determines that she would not be competent to care for this client in consultation with an RN, she should work with her team to identify an appropriate client assignment. Maya also needs to reflect on this situation to identify her learning needs and strategies to enhance her competence in this area of practice. Last, we will consider the environment factors. The RNs and RPNs are working in a practice setting that has recently undergone major changes due to organizational initiatives. Many of the nurses have been transferred in from other teams, and there are a number of nurses who have left to work elsewhere. In addition, most of the new staff members are recent graduates. In this situation, we can see some clear indications of a less stable environment. Many of the nurses are new to the care environment, so even though they may have strong clinical backgrounds, they may not be familiar with all of the policies and protocols that are specific to this practice setting. The environment has experienced a turnover in staff, and there are now more novice nurses. This means that there will likely be more nurses who require consultation and fewer nurses available to provide consultation. It's possible that the policies and procedures in the practice setting have remained unchanged throughout the transition, but even if this is the case, with many new staff members, it's likely that some of the nurses will not be completely familiar with these policies. This less stable environment will affect the ability of an RPN to care for a moderately complex client that in a more stable environment may be a suitable assignment. In conclusion, by considering the client, the nurse, and the environment, nurses and key stakeholders can decide which category of nurse is appropriate for specific roles in client care. The more complex the client situation and the more dynamic the environment, the greater the need for an RN to provide the full range of nursing care. To continue learning about the three-factor framework and the use of RNs and RPNs in specific client care situations, review the practice guideline and read relevant questions in Ask Practice and stories in the standard. These resources are available on the college's website. If you have questions about this webcast, contact the college. Practice consultants and sector-specific outreach consultants are available to assist with issues related to the application of college practice standards and guidelines. Information on how to contact the consultants can be found on the college's website. Your comments are important to us, so please use the Evaluate this webcast link below to give us your feedback.